You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello and welcome back to Girls with Grafts. I am Rachel Kudlak. I'm one of the hosts of the podcast, and I'm joined by my lovely co-host, Amber Wilcox.
Good afternoon. Just by 4 minutes, right? We're just afternoon.
Yes.
How are you today, Rachel?
I'm doing pretty good. We have some sickness going around our household, so I'm hanging in there, trying to stay away from all of the flu and sickness, but I'm feeling pretty good. So I guess I can't complain. How about you?
Yeah, it's a time of year. Luckily, we're just getting over that in my household, but I'm sure Dr. Mendenhall, who's our guest on our show today, can also relate to having some seasonal illnesses. With that said, before we formally introduce Dr. Mendenhall, we would love if you could give a shout out to today's podcast sponsor, Rachel.
Yes, so today's podcast is powered by Allosource. Allosource is one of the largest human tissue providers honoring tissue donors by creating innovative skin allografts to help burn surgeons heal patients. Learn more about Allosource and their continuing education hours by visiting their resource marketplace listing directly on Phoenix Society's website. So we'll make sure we have that linked in our show notes below. And like Amber mentioned, we are so excited to have on Dr. Shaun Mendenhall, who is a board-certified pediatric hand and plastic surgeon at the University of Utah and Intermountain Primary Children's Hospital. Dr. Mendenhall helps children and adults recover from hand and extremity conditions to regain function, confidence, and improved appearance. Recognized for his contributions to hand surgery, Dr. Mendenhall has received multiple awards, including the F. William Bora Jr. Excellence in Hand Surgery Award, the Joseph H. Boyles Award, and the Service Excellence Award from the Health Network Foundation. His achievements also include selection for the American Society for Surgery of the Hand's Young Leaders Program and the Outstanding Paper Award at the 2023 American Association for Surgery of the Hand annual meeting. And outside of his work, Dr. Mendenhall enjoys spending time with his wife and 3 children. As a family, they enjoy outdoor activities, including baseball, golf, camping, and boating. So welcome on to the show, Dr. Mendenhall.
Thank you guys for having me.
It is a pleasure to have you join our show. Dr. Mendenhall and I had the pleasure of meeting a couple months back now, I think, right? And we had a chance to connect on all of the things that you're doing in the world of burn care, but also outside of that as well. So I know Rachel just read your bio briefly, but I'd love to learn a little bit more about what you're doing today, and maybe a little bit also how you got involved in the world of healthcare and burn care in general.
Yeah, that sounds great. So, I started my journey as a plastic surgeon doing 6 years of integrated plastic surgery training at Southern Illinois University. And it was there that I was introduced to burn care. Well, actually going back a little bit before that, I did have a rotation as a medical student here at the University of Utah in the burn unit. And that was a wonderful experience. And there's such a good interaction of so many specialties to take care of burn, including general surgeons that do burn and plastic surgeons who do some acute burn care and then a lot of reconstructive care. And so then in my training, our team ran the burn unit there at Southern Illinois University. And so I had the experience of doing burn care for 6 years as part of my training. And I really fell in love with hand surgery early on. And so I went on to the University of Pennsylvania to do an additional year of hand dedicated training, both for children and adults. And so that's where my practice has gone, is I focus almost entirely on reconstruction of the hand and the extremities now, both the upper extremity and the lower extremity. And that includes a good amount of burn reconstruction as well. mostly at my current institution in the secondary reconstruction phase after they've been treated for their acute burns, and then I help with all the major scarring and the problems with particularly hand function going forward. And my biggest passion in my practice is taking care of children. So I focus the majority of my practice on pediatrics, and I do some adults as well, but mostly children. So that's a little bit about at least my clinical practice.
Yeah.
That's awesome. And I also just have to point out the amazing backdrop that you have today. I think you win the award for best backdrop. Yeah, the snowy mountains of Utah behind you. Yeah, I was like, wow, look at that backdrop that he's got there too today.
Yeah, I recently relocated back here to Utah, so I'm from here, but I've spent the last 3 years at the Children's Hospital Philadelphia doing a full-time pediatric practice, and but we just missed living in Utah so much and have so many family and professional ties here that we decided to come back. And so I've been back here at the University of Utah in Primary Children's Hospital now for about 7 months, and awesome. We're missing the East Coast some, but it's lovely being back here, and
not
so
as much
really
as that backdrop. Yeah.
No, but thanks for sharing all of that. We love kind of hearing how, especially our burn care professionals, how they really got involved in the field. And one question we also love to learn more about and ask is kind of, what does a typical day look like for you? And I know probably every day is a little bit different, and I'm sure you're involved in research and teaching, but then also working with your patients. So kind of, what does a typical day or maybe a typical week look like for you?
Yeah, that's one of the really fun parts about my job is every day is a little bit different. Being an academic hand and plastic surgeon does mean, like you mentioned, I do a lot of teaching, I do a lot of research, and I do a lot of clinical care. So I really have three aspects to my job, and so every day is slightly different. Most days are spent either in the operating room taking care of children or adults with hand problems. The days when I'm not in the operating room, I'm usually in the clinic seeing patients, either new patients or follow-up patients, those who are preparing for surgery or recovering from surgery. And then we at the university have a huge training program, including, of course, the School of Medicine and then plastic surgery and hand surgery training programs. And so many days were also spent working with the students, residents, and fellows doing lectures and labs where we're going over surgical procedures or doing research with that same group of people. So we have, as part of our research program, we have students, residents, and fellows who are all involved in helping us with our creative and investigative efforts as well. So, and then we're on call, a certain number of days a month, and that's where any emergency that comes into the emergency room, that's major, we have to treat. And, that can be traumas, major, say car accidents or side-by-side ATV accidents, which are very common out here, especially in the summer where, we treat patients with mangled extremities. It could be infections. It could be working with the burn team on a challenging reconstructive case. And so there's some unpredictability when it comes to the call duties. But anyway, it's always very engaging, that's for sure.
So I want to get into the hand mobility and functionality a little bit. I actually myself had secondary burns on both hands. You would never know it today. But I did have pretty severe burns on both hands. And I know recovery for my hands were one of the most important things to me. And as I'm sure most patients, right, like our hands, we can't, right? There are a lot of things we can't do without our hands. But I guess my biggest question for you today is, what are some of the advances you're making in like hand reconstruction, or even research that you're doing currently to help with supporting kind of that hand mobility?
Yeah, boy, that's a very broad question. And I think we could spend the rest of the day talking about that. I'll tell you that, as you mentioned, the hands are such an important part of our day-to-day life, for everything we do, from the most minor tasks of sort of getting ready to the day to our occupations, and then also to our communication and our confidence and appearance, so it's such a broad area. I think, the only other one area of the body that comes close is the face, as far as communication and appearance and function. But so there's so many things that we're involved with as hand specialists, and that's, such a range of conditions and ages, anything from birth differences, patients who are born without a finger, with too many fingers, or fused fingers, or lack of a hand or an arm, all the way up to just simple little, injuries and lacerations, to the severe burns, right? Where burns have such a huge impact on the hands, and often lead to very stiff and contracted digits, or even amputated digits, or hands or arms, as you've had on, some guests on your podcast who have suffered that. So with that, there's so much that we can do nowadays to help mitigate some of these problems, from anything from, we can reattach amputated parts, to we can, for example, if somebody has lost a thumb due to a burn or trauma or whatever it might be, we can actually transplant their toe up onto their thumb position and restore filling and movement and pinch. And the appearance is slightly different, but it's certainly better than an amputation. And then thinking a little bit about your technology question, we're in an era of prosthetics that is better than ever before. And that includes prosthetics, even for just single digit loss. We now have these movable, incredibly strong and durable prosthetics for fingers. And that's an area of my research that I've focused on the past few years, is how can we restore function through these newer prosthetic devices, and then how can we get our insurance companies to pay for them. So there's a broad sweeping answer to your question, and then we can certainly talk about any of those topics as well.
I think when it comes to the prosthetics, my question for you would be, are these prosthetics things that require like surgery, or do you think that, or are there prosthetics that require surgery, or is it just as you and I are thinking, like, right, like an attachable limb like we've seen in some cases?
Yeah, it can be both ways, really. There are often things that we can do surgically to optimize the hand or the residual digit for fitting with a prosthesis. So there are some times when I have to either augment the soft tissue if there's not enough soft tissue to support it, or I sometimes have to shorten a digit, or things of that nature. Have to get rid of the pain that's caused by the nerve endings that are causing neuromas and things that cause pain and limit the ability to use a prosthesis. So there are often things that we can do to sort of tune up the hand to make the prosthesis fit better and to work better. But some people, just at the level that they're already at and the movement level that they're at, are able to get fitted right away for a prosthesis. The other thing that's very important is the hand therapy aspect of it. Many of these patients require hand therapy both before and after by certified hand therapists to get their hands in a functional position enough that they'll maximize the amount of movement from a prosthesis.
I think the hand therapy is an important note, because I know when, even just with the secondary burns that I had, that was my biggest concern, is that I felt like I was still constricted because I had that new skin on my hands. And I will say the biggest piece or the greatest piece of advice I thought someone had given me, and I'm sure you have other tips for it as well, was I had the putty for my hands that worked really well. But I also had, and I didn't know they existed until someone told me about them, was the guitar. They're like for people that are practicing, I think on or piano or guitar, where they have like little, and we ordered ours on Amazon, but it was like a great thing for me to practice like this specific isolation of each finger. And I loved both of them. I thought they worked really well, and it was great, especially I was in recovery, but also still trying to work at the same time. And so I would often sit here at my desk with the putty or the finger kind of test, and it would help my mobility in both my hands. And I loved being able to have something that I could play with while I was speaking to someone, because even as someone who's very like uses my hands quite a bit, I found that they were very helpful for my recovery.
Yeah, that's such a great example of how, therapists can help. And I often say that the outcome of the surgeries I do on the hands are about half of what I do, and the other half is how the therapists guide the patient through the rehabilitation process. So that is such a critical part. And all those devices you mentioned, those are all usually toward the end of your recovery when you're really trying to get your strength and your dexterity back.
Yeah, because I also have pretty bad scarring on both of my hands, and the therapy was always the fun part though, because I could just go play with things. That was what I had to do. It was just go play with Legos or whatever, art, just really anything that I could use for my hands. But, I keep looking at my hands actually, because I did have a question on like with the nails of the fingers and digits. I was always curious of this growing up of how does that factor into reconstructive surgery? Because I remember, when I was younger, my doctor said, because I was like, I don't need another surgery. Like, I'm fine with how my hands look and function. And he said to me that, when I'm older, I'm going to want to like go get my nails done. And now they have so many different ways to get your nails done these days. But at the time it was like I would never have went and got my nails done because I was self-conscious of how they look. So I'm just curious of how kind of that plays a role into your surgeries, if it does at all.
Yeah, you bring up a good point. The nail unit is such an important part of our hands function. And, it's both for like picking up things and grasping things, but also for the appearance. There's this term that we try to use more and more nowadays is called social functioning. And it's really just a substitute for, saying something's cosmetic or aesthetic or because it is such an important part of our daily lives, and social functioning. So we go through great lengths actually to repair the nail beds when they're damaged, to even try to replace some nail tissue when it's damaged and save it at all costs because we know about that impact. And, in burn patients, especially those who have burned the back of their fingers, sometimes that scar, as most scars do, shortens and contracts with time, and it can lift the fold, which is the part that covers the proximal end of the nail. It can pull that back, and that can lead to nail bed deformities because that fold is very important for smoothing out the nail, for giving it its final shine and texture. And so there's actually procedures now that we can do where we can advance that tissue back where it belongs to recover the nail fold and the proximal part of the nail and restore some of the appearance and shape of the nail. And so it's interesting you bring that up.
I want to go ahead, Rachel.
No, go ahead. Go ahead.
I want to talk for a minute about your pediatric patients, because I know we had a great conversation when we got to meet in person about how resilient pediatric patients are, but also I feel like how easy they are compared to some of your adult patients, right? And I think we had a really good conversation about that, but I think we have a lot of listeners on the show that may have children, right, as burn survivors, or even potentially pediatric like patients that may have not been burned but are doing some reconstruction surgery. Can you tell me a little bit or talk a little bit about, in your opinion, the difference between your pediatric patients and your adult patients?
Yeah, that's a really great question, and I've now spent about half of my time as an attending surgeon taking care of only kids, at the Children's Hospital of Philadelphia, and then the other half taking care of adults and kids. And so I've really been able to see the contrast between the two, and it's amazing taking care of anybody, right? All patients come to us as providers in a vulnerable position, right? They've had something happen to them that was unfortunate, and their family members, their friends can't help, but we as providers get to come in and be that person who can help them. And so it's such an honor to be able to be in this position to treat people who need it. And but there is a contrast between adults and kids, and part of it is I just love kids. I have 3 of my own children, who obviously inspire me every day, and I've just grown to really being able to just relate well with parents as a parent myself, and then also to try to cheer up these kids who are going through a hard time. And one thing I have noticed that Amber and I talked a little bit about at our meeting was, kids are just so single track minded on getting better, and sort of, they almost just try to ignore whatever the ailment is that they have. They just want to get better and get back to life and get through this thing that's holding them back a little bit. And so in that sense, they are very resilient. I find they experience, or at least they often deal with pain a little bit better than adults do. And they don't have any ulterior motive, where some of our adult patients, and this is probably true of all of us, right? Like, we have a different view of the world than a child does, and there's so many other things that can sort of take us away sometimes from our final goal of just getting better. And anyway, so I love the fact that kids, they come in with this horrific burn or injury, and they go through this hard time, right? And often multiple surgeries, right? In these types of cases. But at the end of the day, they just, they're playing with their toys. They're happy, they're cheerful, they're ready to just kind of go back out into life. And some of it might be just that they're, they don't know what the future holds for them as much as maybe an adult would. But anyway, I love that aspect of caring for kids, that they're just so resilient and focused on getting better.
I think that's interesting that you were talking a little bit about kind of, or Rachel was talking about toys. Rachel is a pediatric burn patient herself. And so I think that's fun, right? I'm sure it's easier, or maybe it's not, as someone with rehabilitation, to present something like a toy to a child, whereas adults, we just want to hold our phones all day. I find that interesting. And I wonder, Dr. Mendenhall, is that something that you find is easier because they just want to play and be physical with toys versus kind of just wanting to sit there and watch TV or be with their phone?
Yeah, I see some of both. Of course, screens have become a major factor in children's lives, and certainly my kids spend a little too much time on screens. But I do find that screens also can be great rehabilitation, so they're often very interactive, the games that they're playing or the shows that they're watching. And so that can be a positive thing as well. But what's interesting, I just had a thought as you were talking, that kids will often also mimic sort of what their parents' reactions are, right? So, for example, if a parent brings a child into my office, or I'm working with them in the hospital, and the parents are super nervous and super uptight and worried, then the kid's going to reflect that exact same behavior. But if the parents are calm and collected and reassuring and confident, then the kids also reflect that same behavior, which is kind of an interesting thing that we see in the pediatric world.
I think that's so true. My husband and I, as you know, have a 1-year-old, and as you probably know, having 3 kids of your own, like 1-year-olds love to just fall. It just is a fact of nature. And he throws himself about quite often, but also, trips, skips, whatever is going on, he'll fall. And I've tried to make it a thing with even, in-laws or in my family, do not react. Like, if he falls, don't do that. Because the more that you do that, the more likely he is to and it's hard, right? I feel like it's really hard for us to not have this big reaction to whatever's going on. But yes, I've seen it happen just on my own of okay, if we can stay calm, cool, and collected and not make a big deal out of it, they're more likely to kind of just bring their emotions down. And even when he does have a reaction, like a cry or whatnot, he tends to bounce back so quickly. He'll just turn around and go back to what he's doing. And most of the time, I think the crying that is happening, what I've noticed is more because he's being taken away from what he's doing to like be consoled than it is to just like keep going. Like, okay, you're okay. Now he wants to turn around and go back to what he's doing. But yes, big reactions. Like I've had lectured our family and my husband's family, like, don't make it a big deal. Like, okay, he fell. All right. Yep. Let's brush it off and keep going. Because I think it makes you almost more resilient to kind of know that falls and trips happen, but kind of get up and be able to keep going. And so I completely understand. And I think we even talked about that, of like those big reactions. And I'm sure sometimes it's almost easier to remove the parents right from the situation and deal with the kids, because I think sometimes parents have worse reactions than their kids do.
Yeah, I would love to hear if Rachel has any recollection when she was going through all her burn care as a young child. Do you recall how your parents reacted and if that was reflected in any of your behavior?
Yeah, it's funny because when you were talking about that, I was thinking back. I've gone countless surgeries. I can't remember anymore, but there was only one time from the entire 18 years, like from when I was 3 to 21 getting surgeries, that I can remember my parents freaking out, I guess is the right word, because I was having a reaction at the time. So, I mean, makes sense that they were allowed to freak out in that case. But, all the other surgeries and therapy, I can't remember any being scared. I mean, the worst part was the pressure garments, as many survivors know. And I remember fighting them on wearing those. But aside from that, there's never a time where I was scared for a surgery or scared to go to therapy or whatnot. Maybe it wasn't fun, especially when I got a little older, but it is really true. The parents and caregivers, how they react and how they go in, and even just going and talking to my doctor. Like I said, I'm sure not everything went right all the time, but I can't ever remember a time where I felt scared about it. So it's definitely true.
Yeah. So, for our parent listeners, I mean, that's just such good advice, I think, is the kids are going to follow your example and how you are reacting. And if you can sort of move forward with confidence and reassurance to the kids, that's going to be huge for their response.
Mm-hmm.
Dr. Mendenhall, and I'm sure this happens with you as well, but we just actually had my son's haircut yesterday. And anytime I think about like going into an event with him, right? Whether it's like getting his haircut or we go to the doctors, and have to get shots quite often. My husband and I come with like this toolkit. And I don't know if you have parents that do this or you guys use your own tactics, but we always have like things with us that we know will distract him. And usually it's Miss Rachel on the iPad, but it's also been like in the doctor's office, they always have for whatever reason, he is obsessed with these. And we actually just bought some on Amazon, and everyone was laughing at us, but they're like the tongue depressors, but they are cherry flavored. And everyone like at the doctor's office tells us how kids are obsessed. My son knows where they are now, like in the doctor's office. He'll pull out the drawer and like grab them. But they'll do the blow up like gloves and whatnot. So do you guys do things or have you seen parents bring things that are like good distractions for that, right? Like, so for our pediatric, parents, are there things that you've seen work really well? Obviously, like screens work really great, but anything else or tips or tricks you have to make, I think, like those things that you have to do but don't want to easier?
Yeah, so I will say by far the most common thing that parents use is their phone, or a tablet to try to distract the kids. And, many pediatric practices, and certainly in the pediatric hospitals, we have child life therapists. That's their entire full-time job, is to come in when we're doing something that might be uncomfortable, whether it's a dressing change or pulling out some pins or something, and they can help distract or at least entertain the child while this is happening. But yeah, as far as other things go, lots of parents bring in coloring books and crayons and, things just to kind of keep the younger kids engaged while they're, getting their treatment. And And then in our office, we typically have, for example, we have a little toy machine, and it takes these little tokens, and so we sort of help reward the kids with a little token if they do their best to try to be brave. And simple things like that, I think, can really go a long way. And certainly the clinics where we have a child life specialist, that's tremendously helpful also.
That's awesome.
I also had a stuffed animal that's raggedy and disgusting now, but came with me to all of my doctor appointments, therapy, would go in. I went to Shriners and they let me bring in Gypsy, that was my dog's name, with me into the surgery. I'm sure they probably took the dog away eventually, but when I was still awake, the dog was with me.
That's awesome.
Yeah, it's so nice to just, it's those simple things, I think, that can make a huge difference. And a lot of times we have children that bring their little stuffed animals, and our nurses will always try to do a little bandage on their hand or their leg or something, just so they kind of feel like they have a partner in crime as they're waking up from anesthesia.
Yeah, definitely.
I want to talk a bit about reconstructive surgeries. And I know it can be really difficult. I think as a survivor, it was really easy for me to make decisions for myself. But I want to talk for a moment. I think as a parent, I always find it very difficult to make decisions on behalf of my son, right? Whether it's like, should I give him this medication, or be able to know, like, is he in pain or not? So, and I'm sure, like, especially when they're really little, they can't really tell us, right, what they want. How do you kind of go through that decision-making process with parents when you're trying to make a decision of whether to do a surgery or not, or whether to do something which way or not? I know you can always give your best advice or recommendation, but I'm sure it can be difficult you can't always make the decision. The parent is usually the one that has to do the consent. So how do you kind of go about that process and recommending things for your patients, especially pediatric?
Yeah, sometimes things are very clear cut, right? And we only have the option of doing whatever the surgery or treatment is. But there are many, many times, especially in burns where, they have a little contracture of a finger, for example, and they can't straighten it out all the way. And, we have a lot of options, right? From scar massage and therapy and splinting and stretching and silicone and, all these things, or trying to determine the time when it's appropriate in growth to go back and surgically release the scar. And that can be done either with just rearranging the scar, like in a Z-plasty, or just getting rid of the whole scar and replacing it with a full thickness skin graft or something. And, these are often very complex conversations and complex procedures that we have to describe. And so as a provider, what I try to do is I try to first gauge the understanding level of the parent and the child and just see where they're at and see where they're starting. And then I'll just try to explain all the options and then help them make a joint decision. I often have my strong opinion, and sometimes it's important for me to say, listen, you need this surgery, but it's not always that clear cut. And so I just try to explain it to the parents and the child, and so everybody's on the same page. They know what the options are. They know what the timeline is when this will need to be done. And it's often a very good, again, that's why I love doing pediatrics, is it's such a great conversation. And I love, having this privilege of providing the resource to parents of the knowledge and the options, and then I help them make the decision. But it is a very joint, that's the whole process of what we call informed consent, is just letting them know all the benefits of the intervention, as well as some of the risks and drawbacks, and then we all together kind of make a joint shared decision. And sometimes it involves getting other opinions too. Sometimes it means, seeing another provider and getting a different perspective. And sometimes for me as an academic surgeon, I take these challenging cases back to my entire group and present it to our group, including all the other surgeons, all the residents, and even students. And I say, this is a very challenging case. Here are our potential options. Am I missing anything? Number one. And number two, what do you all think about this? And so sometimes we even get that external support in decision making. And then, oftentimes that leads to, I think, making the right decision as a group.
Mm-hmm. Yeah, and I just also want to share a little bit from my experience too of, I don't know, Dr. Mendenhall, if you feel the same, but I loved how my parents, really encouraged and pursued getting these reconstructive surgeries when I was younger. At the time, of course, it wasn't fun. Every summer vacation, I went for another surgery. But now as an adult, it's, my life is so much easier that I went through all of that when I was younger. I don't know, like I said, if you feel the same way about that, but I also think about sometimes too with parents, it's like, well, especially when they're really young and as you grow, of course, you're going to have to continue to get surgeries depending on, your burn scars and whatnot. But it was, I'm very thankful that my parents really pursued that when I was younger.
Yeah. And you're so fortunate that you had access to that good care, right? Because much of the world doesn't have access to it. And there's so much that during growth that happens, particularly with your hands and extremities, that if you don't intervene at the right time, it can have a permanent impact, on your function and on your bone development, on your joint flexibility. And so, it is critical to sort of have that team approach, including parents, on, hey, these are the things that we're looking at and what we need to address now during growth. Otherwise, the fingers might be totally curled or totally rotated or bent and not fully functional. So, and that makes me think a little bit about, again, a lot of the world doesn't have access to the surgical care that we do in our country. And so we're very fortunate, right, to have these amazing ABA burn centers and then, to have access to reconstructive surgery. I just recently had the opportunity to do a 2-week surgical mission in Ukraine for children.
That's
and
amazing.
Many of the conditions I saw were burn related, and without access to high level burn care and at least subspecialty trained reconstructive surgeons, there was a lot of major deformities. And so it was very humbling to see. And but the great thing is we had a lot of support to go and to teach the surgeons there some of these tips and tricks and techniques that we use on a routine basis in our country to be able to fix these problems. For example, I had a little boy, I think he was about eight years old or so, that during one of the electricity blackouts, due to the war, they, to stay warm, had to build a big fire, and he tripped into the fire and burned a good portion of his body. And so I had a very severe neck contracture with his chin pulled down. His lip was fused to his chin. And then he had, very severe scars on the axilla, so he couldn't fully move his arms. And so we were able to teach the local surgeons there how we can move some tissue from his arm, down to where the burn scar was on his axilla to be able to get him motion back. And I think obviously it was super rewarding helping the child. And of course we released his neck and his lip and other things, but the parents were super thankful. The child was very happy. But one of the best things was I got to work side by side with one of the Ukrainian burn surgeons and sort of teach them some of these principles that they just don't have access to the training for. And she was incredibly grateful and thankfully has sent me lots of follow-up, on this child, and they're doing well. So anyway, again, I think Rachel, just you were super lucky to have access to that and to have good supportive parents, right, that helped guide the treatment. And now you're reaping the benefits with the function you have.
No, definitely.
I want to talk for a moment because I know I had the chance to reflect on this for Burn Awareness Week. I'm sure you see some common things, right? And I've had the chance to connect again with my hospital, Orlando Health, but I'm sure there are common things that you see that you're like, if only there was more awareness around this, it would be a preventable injury, right? And specifically, I want to talk about pediatrics because I know there are a lot of parents out there that may be listening to the podcast that either are survivors themselves or are just folks that want to be able to understand more about preventative measures. So what are some awareness, I think, injuries that you're like, oh, if I could get the word out more about this injury, or things that maybe even you do with your kids in your home to try to prevent some pediatric injuries?
Yeah, it's so interesting being a pediatric provider, right? Because, and as a parent, and the reason is it makes us as parents, maybe me a little more than my wife, just so nervous, right? About all these ways that kids can get injured. And so, my kids were probably a little more strict with on certain things. And, specific to burn, I mean, I see the whole gamut, right? Like I see all the traumatic injuries, and I see, again, some of the burns and more of the reconstruction, but some of the worst hand burns I've seen in little toddlers, for example, are when they either trip and fall into a campfire. Since we don't, in our country, we don't have a lot of open fire cooking and things like that, like third world countries have, where they get a lot of burns. But here it's either campfires are really bad, especially because they trip and their face and their hands often, right, get it. Or the other thing I've seen a lot are fireplaces that have the glass, front, and the child to go up and put both hands on the hot glass. That's a bad one. And then, of course, just random other things, curling irons and stove tops and skull burns and, things like that. But typically the ones that are worse on the hands are the direct contact to something really, really hot. In adults, we see a little more grease burns from cooking, like what you had, Amber. I guess yours was caramel, not grease, but same concept, right? It's something that sticks to the skin and it doesn't just drip right off, and so it goes deep. And anyway, so those are some of the things that come to mind as far as burns go. With regards to just other injuries, we, as particularly in this Mountain West region, we see a lot of horrific arm injuries from side-by-side ATVs. So these are like they're more like little dune buggy type ATVs. Instead of the four-wheelers where you're sitting front back, these are more like little dune buggies that you're sitting, there's either 4 seats or 2 seats and you're side by side each other. That's why they call it a side by side, or sometimes they call them utility terrain vehicles. And what happens is they roll these and you get your arm outside either and crushed by the door or by the roll bar. And so we see a lot of kids and adults with just these horrific, many times not even salvageable hand and arm injuries. And so we've done quite a bit of research on this and have reported, our results about how we reconstruct these. And we're really trying to get the word out so we can help make these safer from a manufacturing standpoint as well. But and then little kids, we see tons of door slamming injuries, right, that crush their fingers and damage their nail beds. And so we do a lot of nail bed reconstructive surgery just for heavy doors that are crushing fingers.
My son at 1 year old is always cabinets are his favorite thing, right? And he loves to open and shut them, and or even doors, right? Like, and it always makes me nervous, right? Of like, oh my gosh, because they're, they don't think about it until it's happened, and then again they're resilient, but it is one of those things that always makes me cringe, is watching him get so close to like shoving his finger in a door, because we all know how much that hurts, right, when we do shove our hand in a door. So for a child, they just don't understand. But I think that's a great call out too, is to we had to arm our soft close things are always so nice because we can prevent that from happening.
I did have one other quick question for you, Dr. Mendenhall, with amputations specifically. I mean, I have my one pinky is not your typical pinky by any means. She's a little interesting. Is the goal always to try and salvage a digit if possible? And amputation is like not worst case scenario, but kind of you'll only do that if it's a must. Is that normally how that works?
Yes, that is how it works for the most part. On kids especially, we do everything we can to preserve length and as much of the finger as possible. In adults, it's slightly different. It's still almost always we try to save, but there's certain things that might make recover quicker with an amputation versus salvage in an adult. And so if somebody is, a laborer, needs to get back to work right away, then trying to do some major reconstructive surgery that might take a week in the hospital and 3 months of recovery with still a stiff digit, then amputation might be a better option. And, certain cultures also have different levels of, stigma that come with losing fingers or body parts. And so that's the other thing that we often think quite a bit about when we're thinking of, whether to salvage a digit or not. But again, going back to the prosthetics conversation, we are in a different era now. We do have some incredible prosthetics that, range from a very high definition silicone hand painted appearance-based prosthesis that can make a digit look almost entirely normal, even if it's absent, all the way to more biomechanical looking digits that actually move when your other joints move. And it looks a little bit more, robotic, but can be very functional. So there's just so many good options in this era that I would venture to say that, sometimes we may not go through these very extensive lengths like we used to save a particular digit.
It's interesting. Yeah, it's crazy how much technology has changed just even from when I was injured, and will continue to change. Just thinking of having like a painted digit, if it's an amputation, that's can be life-changing, especially like you said, with different cultures and just in the world we live in. And that's an amazing advancement.
Dr. Mendenhall,
yeah, it is really cool.
Before we close out, I know I have actually one more question that came up I thought about it when Rachel was talking about amputations. I think both as a parent, right, but as somebody who I've seen it happen back when I worked at Disney, there were times where crazy incidents happened and you'd hear about them. But if an amputation were to occur, right, and something happened, what is something that someone should do? Like I've always heard put it on ice, right? So someone chops their finger off, right? Or someone has something happen. At what point is it not salvageable? And at what point is it something like, what should you do? Not that anybody wants to ever have this happen, but I think it is something that is good to talk about, right? Because in that moment, if you know about it, it's probably an easier thing. Do folks bring you fingers and things like that are just not salvageable? But what are some good things that people have done, or I guess to help keep it salvageable?
Yeah. So, anytime a part is amputated, it's extremely important to bring that part to the hospital. There have been some cases, throughout my training and my practice where, in the frantic nature of dealing with a major injury like this, they didn't bring the part. And then they're either calling somebody to go get the part, or they're, sending somebody back to get the part and bring it. But typically what we recommend is going from home to the hospital, just bring the part. You can put it in a paper towel, you can put it in a Ziploc bag, just keep it clean and dry and just bring it. And then in the hospital, emergency care providers are trained to know how to wrap it up and preserve it for us for surgery. So what they do in the hospital is they typically wrap it in a saline moistened gauze, put that in a bag, and then they'll put that bag in a separate bag that has ice. So the ice doesn't have direct contact with the part because that can cause frostbite. And so, and then what we do is, the cleaner the cut, the more likelihood that we can save it. And this is at any level. It can be a fingertip, it can be a whole finger, it can be a part of a hand, it can be the whole hand, the arm, all the way up to the shoulder. We can actually reattach at all of those levels, but it all depends on, how clean the cut was. If the cut is fairly clean, then there's a good chance we can save it and put it back on. If it's completely mangled, then there's a good chance we won't be able to.
Is there a length of time that goes by? Like, not to say that somebody 10 minutes ago got something cut off. Like, is there a length? I know this is a weird question, but is there a length of time that after something happens, you can save it? Or if it's right, for whatever reason, maybe it's been longer before the person took a long time to get there or whatnot. Is there a length of time where it's like, okay, no, this is not salvageable? Or it's like, right, you drove to the hospital, in an ambulance versus driving by yourself. Is there a length of time where it's just not salvageable? Or is it always something that you can try?
Yeah, it's not a crazy question at all. That's typically one of the first questions we ask is, how long has it been? And the answer to the question is it depends on the level. Things that have muscle, we don't have much time. We have maybe 4 to 6 hours. So like an arm, we need to get blood restored to that part because the muscle irreversibly starts to die after about 4 hours.
Wow.
So, but if it's a smaller part, if it's a finger, there's been case reports where it's been reattached up to 90 something hours after.
Wow.
So we have quite a bit of time if it's just a finger, because there's not a lot of muscle, right? Just a hand, there's a little bit of muscle, but an arm, there's a lot of muscle. So it all depends on that. But, our rule of thumb is the sooner we can get to it, the better. And pun intended, I guess. And then the more muscle is, the sooner we got to get to it and get it reattached and get blood flow restored.
What is something you should not do, I guess? Like you said, should not put it on ice if you're bringing it back because it could cause frostbite. Is that what you're saying when you mentioned that?
Just wrap it up in something clean and dry and bring it straight to the hospital. And then again, once you're in the hospital, that's when we'll kind of get it.
They'll do it.
Cooling down, because cooling it down decreases the metabolic demand. It will help us preserve it longer. So when transplants are done, for example, they almost always cool it down and keep it on ice. But yeah, we don't want any direct contact with ice. Again, just something clean and dry. You don't want to put it in any solution or anything. Just get it and go to the hospital as soon as you can.
Well, that informed me. If you learn nothing else today, right, from the podcast,
we're prepared.
Yeah, come prepared. I always have these questions, and you always see these things on I know you're going to roll your eyes and says, I watched Grey's Anatomy, or I did at some point. And you always see these strange, weird things. And you're like, how accurate is this and how not? So this has been a very helpful takeaway from today.
Good. Yeah. Well, if you ever have any questions from yourselves or from any of your listeners, about anything hand related, then certainly reach out. Happy to help.
Awesome. Well, we have 2 final questions that we always ask on our podcast. So for me today, it's going to be, if you had any one piece of advice or encouragement that you wanted to give someone with a burn injury, what would it be?
So to just be that there's so much hope in this day and age. We have so many great advances in technology and artificial skin and again, prosthetics that we've talked about, that no matter how severe the burn is, no matter how severe, the limb loss might be, there's really, really good options nowadays. And we are getting into this era, right, that prosthetics are getting closer to what was on Star Wars, with Luke Skywalker, with the ability to restore not only function, but even sometimes feeling and other things. So lots of good technology and lots of reason to have hope.
Definitely. And just a quick note too, for those listening, if your burn injury happened a long time ago and you're not happy with how something's functioning or working, it never hurts to go back to your burn center or burn unit and see if there's any new technology or advancements that could help you.
Yeah, absolutely. And one thing, I'll just comment on that real quick before you wrap up, Rachel. And one thing is, sometimes the patients and even acute burn providers don't know the full extent of the reconstructive options long term. And that's where, again, where a reconstructive plastic surgeon, particularly one that has subspecialty in hand or in face, right, can really, really help. I mean, there's ways that we can completely replace the tissue with full thickness, healthy tissue from another part of the body. And so many things that can be done. So I love that you brought that up, Rachel.
Mm-hmm.
Well, I love
Definitely.
that you brought it up, because I think sometimes we don't always ask questions. And I think that's very important, Dr. Mendenhall, right? We take face value for what our providers tell us and don't ask if there's someone else that could potentially right, support more options in our recovery. And as a parent, I'm always one to say, thank you, but I'd like another opinion on that sometimes. And so I think that that's super helpful, Dr. Mendenhall, to say like, hey, are there other options, or is there someone else I could talk to? Or if I can't, I, as a parent myself, will sometimes go seek, right, another opinion. And so, or even as a, someone with a burn, I'll say, okay, what are my options? Because we don't always ask that. And I think that's a great, right, call out to say, okay, I don't love that answer. I'd really love to see if there's any other options for me. And I think that's something we forget to do sometimes, is we take, right, you said, something at face value sometimes.
Definitely. Well, and with that said, it is time for our final question, which is our Phoenix Partner question, today sponsored by Allosource, one of the largest human tissue suppliers providing life-saving allografts. So their question is, what is one thing you hope listeners take away from our podcast today?
Well, I think that, there are so many wonderful people, right? Including Phoenix example is a perfect example, or the Phoenix Society is a perfect example, that are out there and ready and willing to help and to share the collective experience of people who have gone through what you or your family member has gone through. And so I just want to, take my hat off to Rachel and Amber and the Phoenix Society and Allosource, right, for supporting, this excellent educational platform. And thank you for all your sacrifice and time that you put into trying to help more patients. And certainly I'm happy to help in any way. Certainly you can find me, on the University of Utah's website or on Instagram as well at PedsHandDoc, if I can help in any way. So thanks for having me.
I love that you have an Instagram, because I feel like sometimes, right, doctors aren't always on social, and it's so much easier to kind of sometimes get in touch or ask a quick question. So I love that you're on Instagram and have the ability to have anyone with questions reach out. So that's awesome.
Yeah, I'm not the most active because I'm so busy with my life and practice, but my goal this year is to be a little more active on social media. So.
I love it. I love the tips and tricks that I've seen doctors out there. My husband actually follows a pediatric doctor who does small TikToks, and she always has these quick, 30-second snippets, and he's always sharing them with me. So anything I'm gonna have to follow you now, because any quick tips you have, we'll definitely love to hear it.
Good. Well, thank you.
Awesome. Well, you have a great rest of your day, Dr. Mendenhall. Thank you so much, and enjoy that beautiful background, because I'm jealous.
Yeah, it's shaping up to be a beautiful day out there. So thank you for having me, guys. Have a great day.
You too.
Thank you.
Bye-bye.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.